I don't know how big.
Just one moment, I'm just double checking.
All right, there you go.
Okay, well, we'll go ahead and call the meeting to order then. And start with the roll call.
Director Mraz? Here. Director Leach?
I am here.
Thank you.
All right. Do we have any public comments?
No public comments, no one else on Zoom, no one in the audience, and nothing via email.
Awesome.
Yeah.
Very popular.
Let it
All righty. Well, we'll go ahead and move into the agenda. We just have really the one item, just kind of a discussion of the strategic plan and some discussion about, I guess, timelines and implementation there. If we could, the way I kind of saw it is, if I could just kind of go over, I have a list of basically 10 bullet points that I have here, that it's basically the strategic plan as I kind of see it. We kind of just, maybe if I could just read that real quick, and then if there's something else that we need to add or something I missed, Barbara or Rachel, anyone, and then we can kind of go from there, and then maybe have a discussion, Rachel, or update on how you see like the work plan or the timeline, I guess, on a lot of this.
Okay.
And then we can kind of go from there. So what I have here, like I said, 10 bullet points. Number one is renovate building number one to include a demonstration kitchen and cooling center capabilities.
Yep.
So got that. Number two, make the facility ADA compliant. Number three, write multi-year grants for some of the programming that we would like to kind of move to that 3-year grant window. Number four, just kind of that ongoing discussion, explore opportunities and partnerships with other organizations for clinical services, or to bring clinical services or urgent care to our community. Number five, continue to support North County Fire District with providing assistance for their ambulances.
Okay, we don't have that on the current plan, but that's an easy thing to add in, and we're gonna have to talk about upgrading the current grant we have with them, because it ends this year. So we can talk about that today as well. Yeah.
Yeah, I'd like to, and yeah, I did get that email regarding the costs, and yeah, I definitely have some thoughts on that for sure.
Okay.
So yeah, I had that. I thought that was kind of a consensus on the board to kind of definitely continue with that as part of our plan. So that's number five. Number six, to develop the foundation to support ongoing programming. I think that we're kind of moving forward with that already, so good to see that. Support, number seven, support community fitness programs. That was definitely some discussion about that coming out of the meeting. Number eight, certificate program for CPR, AED, first aid program. Number nine, opioid prevention program. And number 10, 2 large annual events. So that's basically what I had. I'm not sure if there was anything else that I missed, or anybody would like to add anything to that, but that's basically from my notes from the meeting and just kind of reviewing the meeting minutes and whatnot. So I'll open it up to the floor if anybody has anything on any of that.
Barbara, before I say anything, do you have anything specific to that, or do you want me to run down the list? Or?
No, you can.
Okay. So, Bill, we have already in the short-term priorities for the renovations at the Wellness Center, the ADA compliance, and obviously the Building A for the demonstration kitchen. Actually, we just in facilities today approved for recommendation, the architectural firm that we'll probably want to bring on to be able to do that demonstration kitchen and upsize that multi-purpose room. We'll talk about the cooling center with them to make sure that we build in the infrastructure for it. We probably can't really do the next step on the cooling center until Site Logic is done. Because I think the main question we have to figure out from both strategic planning and facilities is really, if we're gonna do a cooling center, we've got to make sure that we have the power capability in the event of a brownout or something like that, which means we have to be independent of the grid, which gives us the option of having full battery backup, with our new solar option that could occur. Or we'd have to consider a generator. The problem with the generator is you have to have fuel on site. And that's a less easy process for us, but we'll have to research both of those. So I actually have built into the plan, basically the research and plan for a facility to become a cooling center. That'll include those power needs. So we'll research this and get it kind of figured out while we're going through Site Logic and while we're going through the redevelopment of that multi-purpose room and demonstration kitchen. So I still have that as part of that 1 to 3 year short-term priority. Does that fit with?
Yeah, no, I'm not expecting anything like, tomorrow or anything. I just want to make sure that we're definitely, creating some sort of strategy for that and kind of working towards that as an eventual goal.
Okay, so I've got that on there, and obviously we'll keep those two pieces together so that during that whole work plan, we're keeping the conversation about the infrastructure as part of that, with the ultimate goal of being able to do that cooling center. And we'll get more information about how we would energize it, basically. We also have on there as point 1 actually, is to bring all facility buildings and space into ADA compliance. So again, we talked about that today as well in facilities, specifically for the last part of the education building, which has those 2 exterior restrooms, and then those last 2 classrooms and those interior restrooms. That all has to be brought up to ADA as well as the house.
Yeah.
But we'll get a lot of that kind of started as we move forward with building A, and then we'll bring while that's going through the design phase, we'll start and figure out how to get building B done. The conversation we actually had was, it would be great to have those 2 classrooms and those restrooms in building B essentially be out of use at the same time that Site Logic has us closed down for that month or 2 at most, when they're doing the parking lot project. It'd be great if we could time that, because then that way we're not losing any additional time or facility space. So that's the working plan.
Well, hopefully they stay on schedule then, huh?
Yeah, we're hoping, the Site Logic is letting us know that by mid-May, they're anticipating being 50% done with all design and can kind of start the initial permit process. And that will start to really solidify when we'll have to be closed down so that they can get in there and really tear up the parking lot and do all that. So we should know that by mid next month.
Okay.
And that was all under the 1 to 3 year priority. So that's probably the fastest of the timelines.
Understood. Yeah.
Okay. And then, I still also have in that 1 to 3 year, the 2 things that you already, pointed out, which has to do with the programming, which has to do with the CPR AED training. We've already started that. I think you saw that from the last board meeting. We did the CPR training AED with the grantees. We have a good vendor in town that gave us a good price on it, was really flexible and easy to work with. So we're gonna reach out again to some of the other grantees who didn't show up and find out if it was just timing or what we need to do for that. And then to try to figure out what level of CPR certification do we actually need to offer to the community at large? And what component of the AED training do we need to do to the community? Keeping in mind your concern about how, I think you said Ingold Park, they had an AED, but nobody knew where it was or how it worked or when the last time it was
I
charged.
can
or-
reach out to them. I mean,
Yeah, but before we reach out to any individual, we need a process.
yeah,
Because we can't one-off every single park or entity in town. And we really need to have, North County Fire
Yeah.
Mhm.
be the main partner in that. Because they're the ones who put it on Pulse Point, all of that.
Mhm.
So that's a conversation in progress for the CPR AED to the community.
Yeah, and I think that's definitely where I'd like to see it get to at some point, maybe if we partner with a high school or, other different organizations, just anything that can kind of promote that and get that out there. And the more that we can kind of, get that education out to the community, I definitely think that that can be a big component of, our mission plan and helping, helping people live longer lives and definitely making an impact on their health for sure.
Right. I know that Teresa's done a lot of work with Mary Murphy at North County Fire to do a lot of the sidewalk CPR. And then some of the AED training has gone in place with that. So we're just trying to formalize a little bit more about that. Those have not needed to be certification classes, which take much longer and more expense. But we do need to find out what entities need a little bit deeper education than just that sidewalk CPR. So that's part of our ongoing what's next to reach out to.
Yeah, no, I just think that my takeaway from the workshop was that the board's consensus was to try to get a certification in place. That way, there's more value for the community or our partners to want to try to get the training other than just kind of learning sidewalk CPR. I think if you offer sidewalk CPR, there's going to be obviously less people that are going to be interested because they don't get the value of the actual certificate. I'm not sure what agency is the best for certifying or what's the best process for that, but
Well, we've got a partner for the certification. We haven't had a lot of requests for the certification from the community. But we can do a little more research to find out if there's a need for that, or we can just schedule a community one and see if and how fast the seats fill up.
yeah, I would be, definitely in favor of that. I mean, I don't think that anybody's going to come ask us until we start kind of like, providing like some sort of, class or until we do it once or twice or something. I think once word gets out there that there's a possibility, I mean, can't hurt to try. I mean, I think it's definitely something that can benefit the community for sure. So.
Okay, well then we'll circle back and make that list of who to reach out to, especially those entities that have AEDs listed on Pulse Point. Because we want to wrap all that together like we did for the grantees. Okay. We also have the continued opioid awareness and harm prevention services. I know that Bianca has it, I don't know when on the calendar. Do you remember, Teresa?
Oh, I'm sorry.
When the next opioid education harm reduction?
I think it's on the calendar for the fall.
I think it's for the fall. So we have, again, that ongoing partner with an entity that got quite a bit of county funding. They're able to manage the risk and liability that all that programming comes from because they got the funding from the county to do that. But we can be essentially a site and a partner for them. They've done it once. We had a pretty good turnout. We talked about doing it again and it's on the calendar for the fall. So I figure if we're doing that kind of on a biannual basis, anything beyond that, we're just not having a lot of requests. There's a lot of folks who have questions and we are able to get them directed to the right resource. But we haven't had any other requests for Narcan or the test strips since then, have we?
Not, we, just a few groups and, CERT.
But we provided those supplies to all
to
them, yeah.
Yep, and we continue to let, all of the grantees and the, collaborative, the community collaborative for health and wellness know that if they need those supplies,
We've got
train
them,
them, they can come back and get more, but we haven't had many requests.
yeah. But we do have that as an ongoing resource.
Mhm.
Awesome. Good
Yeah,
deal.
and we'll keep
Yeah, I
that.
think that makes sense.
Sorry, go ahead.
No, I was just saying, I think that makes sense, what your strategy is. I mean, we don't have to do some sort of class every month or anything, but you know, just it being part of that strategic objective to try to make an impact in that area. I think that's definitely important.
Okay, good. Regarding the fitness programming, I spoke with, besides the chair yoga program, which we just signed up Leslie to start teaching, and that class is already full and started.
Yeah.
Yeah.
Started yesterday.
I reached out to another gal in town who has done a lot of community fitness programs. Like, she's worked with a lot of gyms to help them launch their fitness programming. It's gonna be, I don't want to trigger it until we finish some of the renovations on the buildings, because they take up a lot of space. And we need to have the space finalized before we start those classes. I don't want to start, stop, finish construction, and then try to start up again. So
Yeah.
I've got a lead with her, and I think once our construction is essentially done, we can bring forward a plan from her to say, here's the kind of community fitness programs that can work here, that don't require us to building a gym on site. But some of the
Yeah.
resistance stuff, some of the education, trying to figure out some options with that. I'm gonna have a follow-up conversation actually with Carla from the Fallbrook Land Conservancy. She mentioned when they didn't get funded about the fact that they have these guided tours and these wellness walks out at the preserves. That might be the perfect partner for a walking fitness program, where people who might be a little intimidated, that we could fund and maybe fit more in that MOU format, that we can then truly be a partner on and get folks out to some of those walking courses that then we don't have to build.
Yeah, no, Rachel, I think that you're spot on that. I think that that's a great idea, and that's definitely a partner that has some resources for us, like out there in the outdoors, where, like you say, we don't really have to provide much infrastructure besides, hey, everybody come out, like, let's, walk in nature and get some exercise out of it, for sure. Great idea.
And I'm sure the Land Conservancy is gonna ask for some funds to help, provide some salary assistance to the guided tours and the people who are leading the walks. Okay, well, that's probably a reasonable expense that we can build in as part of our programming. Then we're also promoting it. We get to take some ownership and get some credit for it. So I'm gonna talk with her the first week in May, I think I'm scheduled, right? So we'll talk to her from that avenue, and I think that fits well into the start of the fitness programming without us having to worry about actually building a gym or anything of that sort. So, and then we'll bring more ideas about that once construction is done.
I think it's a good opportunity to reach out to the senior center as well. To get a program going on it, or maybe work with them with a program they may have going on, because a lot of seniors get up early, they'll go have breakfast, they're, trying to figure out what to do for the day, but if the place is open, if they have a little exercise program, it doesn't even have to be with equipment, it could just be maybe chair exercises, stretching, maybe a little Tai Chi, or just morning.
Yeah, well, I mean, the Tai Chi class is busy and full.
We have 4 Tai Chi classes.
Right, and then we have the chair yoga program that people can pay for. And then we have our chair yoga program that our participants or lower income folks who can't afford to pay can access.
Right.
So there's a fair amount of that, but I'll circle back to Susie at the senior center and see what they're offering on their site.
Yeah, And we let like the participants in the lifestyle change program know about these opportunities all around Fallbrook. So we
Yeah.
try and include them in. We may not be the right fit. And then we constantly have like different things that come up to explore, like right now with Aetna and CBS, about maybe having a fitness class for
Oh,
their
okay.
members. So these are like, I have a follow-up meeting with someone. So there's always kind of different things that we're exploring.
So Bill, I mean, that's a lot of the weeds, but around the fitness programming, we are working on those options. Just know that you're gonna see that on the closer to 2 and 3 year mark, mostly because we need to have the facilities completed before we add more of that on site.
Awesome. Yeah, no, I think that, based off of what's going on, I think we're definitely headed in the right direction for that. And, you know, we can definitely build it out from there.
Okay, perfect.
And I think with us running that lifestyle change diabetes program, I mean, it definitely segues pretty nicely into some of the fitness type programming. So I think that, you know, we get some of those people excited about the program, and they're going to probably want to get involved in some of that. So, so excellent.
Good. Regarding also in the 1 to 3 year, I have the adjust the process from annual grants to move some of our district housed services to the multi-year format. And the working hypothesis has been that we want to have those be entities that are providing some service at the Community Health and Wellness Center. So we don't want to just grant to groups that we always grant to, but groups that are actually able to offer something at the center. I believe that was one of the things we wanted to work on. Is that still a correct assumption?
I didn't exactly interpret it like that. I mean, I would be okay with that, you know. I was looking at maybe just some of the programming that we just consistently do every year. I mean, maybe some of the like the food pantry program or the Boys and Girls Club, water safety. I mean, I would be open to maybe, you know, you proposing some sort of process if you're open to it, you know, for some of those programs to get maybe a more stable funding number over a 3-year sort of program. I mean, I would be open if you're just wanting to do programs at the center, but I mean, it might make it an easier grant process for the board as a whole if we were able to take some of those in a block and say, you know, we're going to fund some of these, you know, we're interested in funding you for 3 years, and what's the sort of level that we can kind of be comfortable at. And it might make the final process a little bit easier rather than kind of looking at those programs every year and just kind of wondering what that number is going to be. But I'm open to whatever you're good with on that, Rachel or Barbara, whatever your thoughts are.
Yeah, I agree with you. I would think that, based on the grant applications that we had, a lot of them have been established. Some of them were new, but we always want to look at the projected outcomes. And if we have funded them before and we can't measure, you know, what they're doing and how what they're doing is affecting the community in some type of comprehensive number, whether it's the volume or it's the frequency or if it makes a great impact, we don't want to have that duplication of services. So based on how well they're structured and how well we can measure the outcomes and how well they're working with us, I think that would the focus be to, you know, build a new program. But I'm with the idea of not duplicating the services and bringing more over to the wellness center. And I really think that the emphasis on the mental health is going to be really escalating in the near future. We're going through some very difficult times now. A lot of people have no idea about civics. They understand how the government works. They don't understand the changes. They get upset by the news. And the whole idea is to stay grounded, stay focused. You know, we can't control everything, but if we are educated and we know how to deal with what's in our community, I mean, that's there's our home, there's our neighborhood, there's our community, we're gonna be okay. You know, because there's gonna be a point here in the near future where it's gonna just go bonkers.
So let me make sure I'm capturing for both of you. We would consider not only district housed services, but also some of those longer relationships that have proven
Yes.
outcomes of impact into the community, that we would consider that kind of overall catch basin for the multi-year grants. Is that a fair restatement?
I think so. I mean, I would be good with that. Obviously, we would still continue to need the reporting requirements, and it would have to be, you know, contingent on them continuing to deliver the same level of service and everything. But I would be open to, you know, whatever programs that you would propose, that you would think that would be the stable partners that are easier to work with, that we can rely on, as far as those results. And then maybe we can start a discussion with some of those partners about kind of what that would look like and what their request would be over that time frame. So yeah, I'd
Okay.
be good with that.
Okay, I think we could probably start putting some of those together as Raquel and I are going through some of the grant reports. We could probably start to put together a short list. And then, obviously, we wouldn't want to trigger any of that till next
Yeah.
fiscal year.
Yeah.
So that gives us
Yeah.
fiscal year to outline what makes the most sense. So that's great. That's actually very helpful. And then the last one that I had in the 1 to 3 year is specifically to those clinical service options, right?
Yeah.
And we know urgent care, after Judith's research, we know bringing in just an independent person, all of them basically told us we didn't have enough population to come out and support, even if we were gonna underwrite it. But we're now also waiting to see what the Tri-City UCSD relationship will be. I double checked with Jeff yesterday. Those negotiations are still ongoing. Nothing has been completed yet. But we've heard from Jeff and from some of the Tri-City folk that UCSD is motivated to bring more clinics out our direction. And that could be the ideal clinical partner to bring more services our way. So I'm still researching, talking to those folks, but that's probably the best lead I have so far.
I'm just wondering if there might be an opportunity to have a discussion with the prevailing medical groups like Regal Medical Group and Grayville, you know, because.
Well, Grayville is Palomar.
I understand that. I'm not talking about the site. I'm talking about their dollars allocated for those urgent care services or the wellness programs or transportation or anything like that. If we could work out some kind of program with them, because if we are providing services to educate their patients and improve their health by becoming educated, participating in the programs, that's a wellness component. If there's transportation to the facility there to keep them active and exercising, then they won't be going to the doctor's office because something else, you know, came up because they've been sedentary. The whole idea is, you know, they're treating patients for active conditions. And if we can be proactive before those acute situations occur, we're actually helping them to have a healthier population.
So are you?
And I'm just proposing some way to open the door to get the physician groups to be aware of the fact that we as a wellness center here can be a sort of a case manager in tandem with their patients. And then for the programs that we have.
Hold on, I wanna make sure, I gotta make sure I follow you. We already have, Teresa has already done outreach to both the Grayville group
Mhm.
and Regal's group, Rancho Family Medical,
Right.
those two groups, to let them know about our services. So they are a referral feeder to the diabetes prevention program.
That's what I'm talking about.
Right, so now
Yeah, opening
they're
them.
sending clients to us.
Good.
But we're not gonna be able to get more clinical dollars or more clinical care from them
Mhm.
to the center. Both of those groups have made it abundantly clear that they're not gonna give us anything.
And I understand that.
Okay,
But I'm not
okay.
concerned about the medical group so much as I'm concerned about the patient volume, because those guys are getting paid whether they provide services or not. They're on a capitation arrangement. So if we can keep people in our community healthy and have them go to the wellness center, then they're bringing more vitality to the community. And they're promoting, being proactive, becoming educated, taking advantage. And you don't have a whole bunch of sick people trying to go through the referral system and hit the hospitals and the urgent care and all that jazz.
Right,
Because that's the mindset of how the patient-doctor relationship is now. We will treat the problem, we'll
Right.
prescribe the drugs, we will tell you where to go, labs, diagnostics, etc. We understand that, but the idea is to educate the patient to begin with. You're your own best patient advocate. If you know that, orange juice gives you indigestion, for God's sake,
stop drinking orange juice.
let's
Yes.
just keep it simple.
Well,
and it's
and,
okay.
and I think, to that point, we haven't sprung it yet, but it's been on our upcoming list of programming that we're researching, and Teresa and I are working on a tool that we can bring
Yeah.
forward to this committee that says, here's the programs we've got, here's the ones we're researching. And health literacy is a big one of
It
those.
is so
So-
critical. Our population is ignorant about nutrition and what they're eating and how it's affecting their body. And
So, I mean, I think a lot of that education we're bringing forward, as far as this specific bullet point, I want to make sure I'm clear. Bill, your focus really on that bullet point is true access to clinical support services, right? That's one.
Correct. Yeah, just our ongoing desire to kind of maybe partner with, like you said, Tri-City, UCSD, or some other provider to try to bring some sort of urgent care or some other sort of services in the community.
Vista Community Clinic.
So Vista Community Clinic, I don't think they're gonna stand up anything until, as an FQHC, until they figure out the partnership with Community Health Systems, the Fallbrook Family Health Center, also an FQHC. Their agreements are generally, they don't go into each other's territories unless they're offering services the other one doesn't. Now, with that said, VCC is stepping into Fallbrook Family Health Center's domain for pediatrics and a couple other things, but, that's a political argument that I think we have to stay
Right.
out of and see how well somebody can maybe come in.
And the more that they have to deal with the managed care component, you've got Regal Medical Group and you think, okay, Regal Medical Group and maybe you've got Health Met that's contracted with Regal Medical Group. Well, the 900-pound gorilla overseeing that is Optum. the
Well,
management
keep in
company.
mind, both of these FQHCs, though, the insurance they're primary seeing is gonna be Medi-Cal, Medicare.
Yeah, I think this whole thing is gonna change.
Well, not in 1 to 3 years,
Who
maybe, but either way, I
Yeah.
think it's fair to say, because I want to make sure we stay on topic with this one. We are gonna keep our eyes open for opportunity
Right.
for clinical partnership for us. And I think the best we can do right now is just be open to all those conversations. So if Palomar suddenly is able to re-engage with a conversation, game on.
If Loma Linda.
If
or
anybody
Kaiser-
came out here and said they were interested in putting clinical services in town, we'll communicate. I just had a meeting and we did an email introduction over to Teresa and Bianca. There's a new vascular surgeon in town who's planning to do a lot of work for a lot of our diabetes patients, because obviously vascular concerns is a big problem in diabetes.
Absolutely.
He's also doing a lot of the pre-work for those individuals who have to go into dialysis.
Oh, that's
And since the
scary.
only dialysis around for us sends you to Murrieta,
Yeah,
so his outreach to us is he's new, he's trying to get connected. I indicated to him what we were doing with our diabetes prevention program, how we're talking about standing up a diabetes self-management program in a regular ongoing besides the short-term ones we've had. And he's offered to be able to do a lot of education.
Oh, wonderful.
He may be able to do a lot of the A1C blood draws that we've been having problems finding a lab to do. He can do that in his office.
You can go to the pharmacy and get the kit for it.
Well, no, the A1C, the, not just the finger pricks.
No, I know that, but the A1C, you can get the kit. They used to have it in the pharmacy. where
It's
you could-
not, the CDC won't, there's some, yeah,
They don't
validation or
recognize it.
whatever with it, they don't, yeah.
Oh, okay, but either way,
Yeah.
the,
idea is
what I
proactive.
wanna bring back, yeah, is we have this new partnership, so we're gonna continue researching and looking for those and hope that that can expand some of those clinical services. With the potential increase of population from Horse Creek Ranch and all that development along Bonsall, our population is gonna grow. So eventually that's going to start attracting more clinical services. But we're gonna try to stay on the forefront of that and attract as partners as much of that as we can. And we'll have to figure out what kind of skin in the game they're gonna expect from us.
Well, another opportunity that we may have with this vascular surgeon is him addressing the topic of the vaping with the teenagers now and the young people, what that's doing to their circulatory system. They
Yeah.
have no idea the
That-
damage that's going on.
Yeah.
And we used to have Dr. Reynolds here, wonderful doctor, and he would talk about these things, and we used to have the community collaboratives, we would have actual pharmacists come out, doctors would come out and address things, and it was so rewarding to have a professional there saying, you may not realize that while you're doing this and this, you're thinking, oh, great, I'm relaxing, and I'm taking this, and I'm feeling good about it. You're kicking yourself into a condition that's gonna come back and just clobber you later on.
Yeah,
And-
well, we'll reach out to him because he offered up education, so we'll reach out to him and see what he has, and obviously that's, having that new voice in town may help get our other physicians in town to want to step back up again.
Yeah.
So we'll continue doing that. I don't have anything super specific for that bullet point, obviously. The Tri-City UCSD is the most current likely partnership, but we're just gonna keep bringing that forward at this point.
I think also, on the same point is, just kind of thinking outside the box with some of the stuff like the technology to be able to do the Zoom meetings there at the office. I mean, I think even just working towards that is definitely, kind of moving in that direction for sure. So thank you. That all sounds good.
Okay, and then really, the only other thing that we need to add to this bill in this short time frame is obviously the North County Fire ambulance conversation. So just to remind everybody, 4 years ago, we signed a 4-year MOU grant agreement to do a 50% cost share with North County Fire for either refurbishment or purchase of brand new ambulances. Because the expectation was every 2 years or so, they would have to buy a new ambulance or refurbish the box on the chassis of an ambulance in order to keep up with demand. So the problem from 4 years ago to today is the cost of those ambulances it goes up every year. It's an unknown to us every year on how much that 50% is gonna cost. So I went back to North County Fire, to Keith and to Brian McMillan, who is the new Kevin Marr, right?
I mean,
To try and find out, all right, like, what are we in for? What are we
anticipatory
looking at?
cost.
Right. So they gave me an invoice for an intent to purchase of an ambulance, and the total cost was like a little over $300,000. I'm estimating it'll probably hit 4 by the time they're done. So I budgeted in for the 24-25 fiscal year, a $200,000 hit. Now, because that would be 50% of that cost share.
Mhm. Mhm.
But because the grant ends at the end of June this year, we have to decide if we're gonna renegotiate that contract with them, how much do we want to fund? Do we want to fund just a flat amount and say every year, we're gonna support 50,000, 100,000, whatever, to your ambulance refurbishment? Or do you wanna stay with this 50% cost share when those costs are going up and it's hard to budget for that?
I understand. Yeah, that's gonna be challenging.
Well, and that's kind of, that goes back to you as the deciders.
Yeah, so, so my thoughts are, I had read your email. I thought that, what I took away was that the last one was 144,000. It hasn't gone up since that point.
Oh, yeah. So the last, I got an intent to purchase from Brian and the price on it was almost 300,000, which meant that our cost would be 150, but that was without the, all the equipment in it. So they didn't actually have the full final invoice. That was just their intent to purchase.
Wow. Yeah, I mean, I think that we need to be in a position where it's definitely a fixed cost. I mean, we can't just go into the budget time and kind of hope and try to project what costs are going to be, especially with the way inflation's been going. I mean, it's very hard to predict some of these things, I'm sure. I mean, I would be open. I'm not sure what the rest of the board would feel about it, but to proposing maybe
Right.
145, whatever that 144,705, I think is what the email said. I would be good with somewhere around that range for 4 more years, or I mean, I'm not sure how long we'd like to do it. I would want to do just a year or two. I'd want to kind of extend it out so that we both have an idea of what that's going to look like. But I think that if we go to 200 this year and 300 next year, I mean, it's just gonna be pretty tough.
I'm with you. There should be a cap on it.
Yeah. Well, we've invited North County Fire. They're gonna come and do their annual presentation of their service numbers and everything at the May meeting. So we can ask them some questions then, and we can put this question on the May agenda, or we can listen to them in May and put this on the June agenda. But we have to make a decision before the end of June, because the contract, as I recall, automatically renews unless we quit it.
You're gonna run it by Jeff to,
Well, Jeff wrote up the contract, so I'm not worried about that. It really, we can set that term that says this, we're renegotiating it and it's gonna say this. I feel confident North County Fire is gonna be happy with us wanting to continue something.
Sure.
But I think the ball is in our court to decide what that amount is.
Yeah, I'm with you, Bill. I think, do we need to run it through finance, or do we need to just bring it to the board for consideration, discussion, and a move to put a dollar amount as a cap on the dollar amount that we would give them in the grant process for the next how many years?
I mean, I would presume that you guys would go to the board as the conversation.
Yeah, I think the board should have a discussion on it, and the recommendation would be, because of what we've just discussed now, that they should consider, looking at that dollar amount being at a certain level for a standard period of time.
Yeah, and I would suggest, Rachel, maybe reach out to the chief and just let him know, I guess, our intent to try to provide, like, I guess, a stable dollar of funding, and maybe ask, I mean, like, what level that, I mean, would work. I mean, I think that we'd like to definitely have it continue to be beneficial, and I really like seeing them bring another ambulance crew in service. I mean, I think that that's all huge for the community. Like I said, I'd be pretty comfortable around that 145. I mean, maybe have a discussion with them about what level would be, what level of help and where they would be funding wise and how that would work. And then maybe they can come out and give their presentation, and if they have any comments, I mean, we can kind of go from there and put it on June agenda or whatever, once we get some feedback from them and kind of hear from the board. But I would just let him know that our intent isn't to put out probably 200 for the next cycle. I mean, I think we're going to be fairly limited with a lot of the stuff that we're doing, but I think that it being part of our strategic plan, I mean, obviously it's a big priority for the board, and I think that for the community, us being able to support those basic life support services and actually get out there and save lives is a big deal. So
Okay.
so yeah.
All right, well, I'll reach out to the chief, have a conversation with him. They'll present in May, and then we'll put on the June agenda to revisit the contract. And what I'll basically do is notify them that we're not going to continue with the MOU grant as it stands. So that one will end, and then we'll enact a new one that has whatever the amount is that gets decided at the June-ish time frame. Does that make sense?
Yes, or you can amend the MOU to
Well,
a new.
the MOU stays in place, but the grant agreement
Oh,
specific,
separate.
that's the one that will separate.
Absolutely.
Okay, they already know, and I've given them notice that we'll not be renewing the one for Mary Murphy. They're able to absorb her salary, so that's not a problem. It's not like she goes away. We've obviously already ended the one for the shared communications person. We hired our own, so that worked out well for a couple of years. So this is really the only one that will be a regular ongoing, from a funding standpoint. The MOU to share information, that stays in place. That doesn't end. It's just the funding one that we need to put a time limit on.
Yeah.
Does that make sense to?
Yeah.
Yeah, for sure. And just on that subject, I mean, I would just say that we should just kind of continue to explore any sort of partnerships with them that make sense for us. I mean, I think that we should always just kind of keep an open mind, especially as we're doing a lot of that CPR and AED and different community education sort of events. I mean, it's good to have them out, and I know the firefighters do some stuff over there at Montserrat Mountain for like the 9/11 and different fitness type things or whatever. So any sort of partnerships that we can get with them, I think would be definitely in the right track. So for sure.
Yeah, I mean, the whole AED and first aid education, a lot of that will absolutely come from them. So that's not a problem. And we have a good relationship with them. So this won't change anything. It just solidifies the business agreement part. So.
Yeah.
Okay.
And if they ever have any different ideas or need any funding for any sort of programs, I think that, they should definitely bring it forward, because we're definitely looking to, do anything that makes sense for sure.
Okay, yeah, and we don't have to formalize that in a separate grant agreement. They already know that they could come to us, and we have a little bit of discretionary money in the health clinics line item that, if we don't fund, the entire amount of the ambulances, that can help fund that other part that gives us that flexibility for other programming.
Right,
So
right.
if there's equipment or something that we have to be part of, we can do that. Okay, and then really the only other thing is, we have we're all in agreement of supporting the foundation to be able to help support programming. Bill, I sent you an email, and we discussed it briefly in the finance meeting, that we're going to fund, well, we've already funded to open account for the foundation. The follow-up part is we need to set up the books, and then we need to have a nonprofit accountant that looks at that. That's easy. I spoke with Marnie, our bookkeeper. She's gonna start working on getting those books set up so that on July 1, we have a functioning set of fiscal books for that. We're gonna meet with Roxanne Green, who is an accountant in town who does most of the nonprofits. We can probably contract with her. Again, it's so small we can have her come and balance it quarterly, right before we do our quarterly, foundation meetings, but the expectation is I'm already starting to look at the foundation to be able to go look for some funds to get our water bottle refilling stations out at the wellness center and some small things to help start getting that charitable out there. Then we can also start talking about, we'll have some grateful participants who may want to make gifts to us, and they can do that through the foundation. So we'll have that process put into place, knowing that funds that go into the foundation are essentially restricted to help underwrite programming costs. So they won't be just shuffled into district operating cash.
Excellent.
And then the only other thing, and it probably won't work this year, obviously, because again, construction to the facilities, but having 2 large annual events. This year it's wonky, only because the facility is completely messy. We do have a program that we are gonna bring forward for Easter of next year. And Easter is probably the wrong time, spring of next year. And that's basically doing a bicycle giveaway and safety training event to the community. We're outlining it right now. We had a couple of staff meetings, so we'll outline that, probably bring that back maybe next month to strategic planning so you guys can see what that event looks like. And the idea for that is to make sure that the community, it's twofold. If the community has a bunch of bicycles left over, right? You give your kid a bike at Christmas, and the old bike, which is too small, can now be donated to us. We get our volunteer groups to come out, refurbish the bike. The district buys some helmets, and we get some folks who come in and can do some basic bicycle safety training so that the kids, and we're talking just for kids, know how to ride a bike in the street or on the sidewalk or in their community, right? You gotta, folks who've never had a bike, or if they're upsizing
Yeah.
into a different.
It's
But
a great idea.
It's a good way to get, again, a lot of our kids and families out. If we do a big event with it, we can have a lot of, kind of like we did for the Ion Health, but instead of it being about, eyeballs, this time it's bike safety.
Yeah.
So we'll outline that and bring that. That'll probably be the really only big event we'll be able to do in the, bless you, 24-25 fiscal year, or April of 25.
Are we
That's
gonna have
kind of
health fair? Are we gonna go back to a health fair at all?
We can't this year because construction is
But
gonna,
next year?
maybe. It really depends. Instead of just doing the same standard health fair every year, what we'd like to do is center it around a different need in the community. We'll bring different resources out there, but we won't call it a health fair,
Okay,
but we'll call it some sort of resource event.
right.
So if they're there for bikes and we know that families are there, that's the perfect time to bring out all those other resources that support families.
Okay,
So that's the initial outline for the one event that we'll really be able to do this year, only because the facility is just gonna be a mess.
yeah, this is
Yeah.
a transition.
It's
turmoil.
a transition
Yeah.
year. The expectation is that we'll do 2 events each year.
Uh-huh.
And the idea is to target different segments of the community. Maybe it's a family one, maybe it's a women's health, maybe it's a men's event. So that we're keeping it lively and not just the same standard thing year in and year out.
Gotcha. Sounds good.
So that's at least the.
Yeah, that sounds like a good idea, and I think with the construction, I think that definitely makes sense. I would, I'd love to see another event with the Lions site group. I mean, I'm not sure if the facility is just not going to be able to work this year. If there's possibility to partner with them at a third-party site, or I like the idea of kind of mixing it up. But I definitely thought that when we had that event, it was a huge impact.
Yeah.
So anything we could do for that, I would definitely be open to, to working
Yeah.
with them and trying to see what we can do with that.
We've kept in touch with their folks. Usually they do that program every 2 years. Is that what she said?
Yeah,
But
they
they're-
share it around.
Yeah, they're trying to find, because they move it around the county, but they're trying to find a few different things. So we're staying in touch with them to see what else we could do.
Yeah.
Yeah.
I love the idea because you got your glasses and you're gonna need them again. And
Right.
obviously people who aren't getting that resource somewhere else, so that would be great.
Yeah,
Well, it's cool to see, I mean, on that day that, it was like pouring rain and still to have the parking lot completely filled and, you know, I mean, I think that just kind of shows the need that's out there for sure. So,
yeah.
absolutely. But obviously this year there's a lot of challenges with the construction, so you know it kind of is what it is. But the more events and the more people we get out there, the better. I mean, it's definitely great to see when we put those together. So for sure.
Yeah.
I wanted to just get a update or just some information on the medical entity that you were talking to about perhaps putting a temporary dock thing in.
So the PACE program. So we reached back out to Gary and Mary West, their PACE program, because we had talked about giving them space for free. Then we toured out there.
Right,
I don't know what happened on their side, but they have pretty much ghosted.
yeah, they just kind of disappeared.
I think what happened is that they had enough challenges with their actual clinical spots that they weren't really able to expand. In some ways, right now, I think that's a mixed blessing for us.
Yes,
Because now we need that space.
yes.
And if that space had been given over, it would have only served seniors. And now we're using it for community-wide. So I'm not sure that's really all that valuable to us anymore.
Well, but I'm thinking more of another medical entity that was looking to do diagnostics and work.
The one with the computer?
Yes.
Yeah.
Oh,
Yeah.
that's the Sesame program,
Okay,
and that would happen in this building.
okay.
So we're still in
In dialogue with
conversation.
that?
Still working with their
Okay.
development teams there.
Okay,
Yeah.
great.
And that would support that, access to clinical services as well. But we would be able to offer that here because it's a one-on-one. We can set them up in a space, problem solved.
Yeah.
Yeah. And that pretty much covers the bulk of everything that was 1 to 3 years. You know, we talked about 3 to 5, that's still some of the additional renovations to the wellness center project, but there's no point in trying to outline that yet because we gotta finish the 1 to 3 year stuff first.
Right.
And that was, I think, everything that I captured. I'll add on to this one sheeter, the, North County Fire Ambulance as an ongoing, we'll put that under kind of that grants world since
Yeah.
it's finance related. And then the foundation support and, annual events. I mean, those aren't really, they don't have time limits on it. We're just gonna do it. So we'll build that in more as part of our policy or practices. It's an expectation that we will be doing these services for these reasons.
Okay.
Does that seem reasonable to?
Yeah, absolutely. No, I think
Okay.
that, you know, the more, I guess, clear and concise that we can be about, hey, this is the direction that we're moving in. And, you know, it seems like you have a good grasp of, how you want the workflow to go and, the timeline on that. So, I mean, I think that, that all sounds like it makes sense and, you know, we'll just kind of continue to check back in on that and hopefully, you know, keep making progress. I mean, the progress that we've done in the last couple of years is amazing already. But you know, it'll be nice to see you know, continue to see this moving to fruition. So
Perfect, good. All right, well, I'll make sure that this is updated and then it'll obviously be in the May board packet. Just as an informational item, and then we'll bring it back, finalized at the May strategic planning.
awesome, good deal.
Okay. Well, that was it for me under the discussion items. So back to you, Bill.
Yeah, no, I think that was really the only item we had here today. I think it was a good discussion and, you know, I'm glad to hear the updates on a lot of that stuff and looking forward to continue to finalize the plan and, you know, move forward with some of that. So that's it for me. Barbara, do you have any closing comments?
No, I just, I just applaud the staff because this is a huge undertaking and I know they're working very, very hard at accomplishing these tasks. We've got a long road ahead of us with construction coming up. From the meeting this morning with facilities, we made some decisions that we're going to bring to the board and we will probably see kickoff and groundbreaking in,
The fall.
I thought it was June, because,
No, that's the design, they start to go into permitting and such,
okay,
but the actual like digging up the dirt.
okay. Okay.
That's like, maybe end of July at the earliest, probably sometime in August.
But I'm really impressed with what we're doing. I think Howard's being back on the board for a period of time is certainly gonna help as well. He's a wealth of information and he has access to, I believe, current data, which is,
Always helpful.
very helpful, especially now when we're like CDC, Department of Health. I don't know where to get this stuff. But I'm encouraged. I'm really excited. I think this is gonna be great. Oh, I'm good.
Alrighty. Well, that's it. I guess we'll just go ahead and adjourn the meeting and, I appreciate everybody's time and efforts out there. And, I look forward to, kind of getting back into the, strategic planning committee schedule. It's been a few months.
Yeah,
So we'll get back to it.
all right,
Awesome.
sounds good.
Thank you,
Hope
Bill.
everyone has a good rest of your night. All right.
You
Thanks,
too.
everyone.
Good luck on your
Talk to you
commute.
guys soon. I'm almost there. I thought I was going to be about 15-20 minutes late, so I pulled over so I didn't lose my signal. So I'll be home in 15 minutes. So
Perfect.
all right, see you
All
guys.
right.